everyone, Dr. Kalaiko here, and it's been a while since I've checked in with you. I've been working on a couple of research projects in the meantime, but I thought today would be a good time to check back in because unfortunately we are seeing an increase in COVID cases and hospitalizations around the world, really. And so what we're seeing is that those who are most at risk for these new infections and hospitalizations are those who are not fully vaccinated. So being fully vaccinated, remember that's 2 weeks out from your final dose of whatever vaccine that you receive. And in fact, in some jurisdictions like Los Angeles County, for instance, all of the people who are currently hospitalized for COVID are unvaccinated. We are also seeing some fully vaccinated people who are getting infections. And this is happening actually with all brands of vaccine. So whether they received Pfizer, Moderna, Johnson & Johnson, or another brand, some people are getting these breakthrough infections with COVID. Now, the vast majority of these infections in those who are fully vaccinated are mild. So meaning the people are able to recover at home without having to be hospitalized. Now, we never expected these vaccines to be 100% effective at preventing every single infection for all time. So remember, these vaccines, all of the available COVID vaccines, are all very effective at preventing hospitalizations and deaths from COVID. And that's really the most important endpoint, is preventing those serious infections. Also, just because a vaccine is not 100% effective does not make it useless. So having some protection is better than zero protection. So much like the influenza or flu virus, the SARS-CoV-2 virus that causes COVID-19 illness is capable of changing or mutating. And so now we have this Delta variant, which we know is more than twice as transmissible compared with the original strains of the virus. So this is bad news. This is why we're seeing these new infections and new hospitalizations and so forth. That combined with the fact that there are some pockets of the population that are not vaccinated yet. So that's bad news. But there's no need to panic. There are still steps that we can take to prevent infections. So if you haven't yet gotten vaccinated, it's not too late. You can start today. So if you get a vaccine that requires 2 doses, it's very important that you get both doses. So we are not considered fully protected until we are 2 weeks out from our final dose. We can all continue to wear a mask, even those who are fully vaccinated. So this is consistent with World Health Organization guidelines. So I myself am fully vaccinated. I've been fully vaccinated since February. It's now July, and I am starting to wear 2 masks out in public again. So I know that I, as a fully vaccinated person, am very unlikely to get a serious case of COVID, but I don't want to get infected and spread the virus to other people. So I have a young child at home who's not yet eligible to get the vaccine, and I want to be sure that I'm protecting my child and doing everything I can to prevent my child from getting infected. So I'm wearing 2 masks. What this does is it closes the gaps and ensures a tight fit. So you can take a surgical mask, make sure you pinch that nose bridge so you get a tight fit around the nose. And then you notice there's some gaps in the side, so this allows air to leak in and out. So you can take a cloth mask, put that on top, and what that does is really tighten up the fit and close the gaps. So, that's one tip to ensure, a better fit when you're wearing your mask in public. Also remember those hand washing and hand sanitizing tips that we picked up in the beginning of the pandemic. So 20 seconds, rubbing all surfaces of the hand in between the fingers, getting the wrists and under the fingernails. So before you touch your face, your eyes, anything like that, be sure you wash or sanitize those hands. This is also a habit. First thing when I get back home, I wash my hands. Avoiding crowds is still a good idea. If you can't avoid being close to other people, then wearing a mask, is the next best thing. And increasing ventilation whenever possible. So being outdoors helps, opening windows, opening doors when possible, all of that is going to help to reduce our risk. So hope you found this information helpful, and I'll see you next time.